I received my paramedic certification in 2011. I had a young man who was involved in an ATV accident, and I made the decision to fly him via helicopter to the hospital based on his clinical presentation. That decision did in fact save his life. Ask yourself, what is your why? Be sincere with it. Nothing, of course, can replace the human hands and the clinical insight and that look that we can give our patients based on our clinical experience. Our changes come from evidence-based practice. I think a college degree is extremely advantageous to the provider and the institution itself. The state certified paramedic and the state certified instructor coordinator. I received my paramedic certification in 2011. Before that, I received my instructor coordinator in 2007 and my EMT in 1996. Understand why. Ask yourself, what is your why? And be sincere with it. That's what I would first determine, because this field is it's grueling, it's daunting, it's not things you don't see on a regular basis. So be certain that you fully understand why you're coming into this field. My favorite part, hands down, is diversity. Um, the few classes I've taught thus far are very diverse. We're in Lower Manhattan. It's a beautiful area to work in. It's a beautiful campus, and just being a part of this microcosm that is New York City is really the biggest reason why I enjoy teaching down here. I honestly enjoyed listening to all the calls on my little radio scanner. It sounded really exciting. And truth be told, that's really, I always wanted to help people. So truth be told, that's what really drove me into EMS. First, identify the stress. See what it is that is the point of the stress, the source of your stress, rather. And I would say try to limit your exposure to that stressor. If it's something that's part of the job, that might be a bigger concern. But as far as your downtime goes, I would say turn off your phone or silence your phone. Um, Working out, exercising. If you have access to gardening, that's very stress free. It's very therapeutic also. I would. I would certainly encourage healthcare, because healthcare is something that will never go away. There's always going to be sick people in this world. I would say if you're going to make a career out of it, make sure that you go after something that is financially stable and sound in healthcare. And that can also perhaps be in nursing as well, paramedicine, EMT, any of those facets of healthcare. I try not to be attached to my cellular device, but simply going on the internet and looking for recent updates, going to reputable websites, going to your regional EMS websites. Usually, updated protocols are found there, and it's important to keep up on the updated protocols, because our changes come from evidence-based practice. So we don't want to be fixated on dogma, if you would. So it's very crucial that you're up to date with best practice and current best practice. I taught my ex how to fish. I would say my liveliness in the classroom, based on past reviews and feedback from students, they enjoyed my engaged in walking around the classroom. I don't usually stay in one spot. I don't pace back and forth in front of the classroom. I literally look at the room. Um, and I do inject a little humor. I don't take away from the seriousness of the material, but there are some components of the class that some students may deem a little dry. So it's my job to line that up a little bit, and that's one thing that my students greatly enjoy. Complacency. Becoming complacent, which then turns into laziness, which turns then into medical errors, and a genuine distaste for the job. I like singing karaoke.
What's your favorite song?
New York, New York. I see EMS involving probably going to see some more AI introduced into the pre-hospital setting. Nothing, of course, can replace the human hands and the clinical insight and that look that we can give our patients based on our clinical experience. I definitely see AI being a part of that upgrade or future, if you would. With regard to how that intertwines with BMCC, I think by staying ahead of the game with regard to best practices, I think keeping a continual foot in the door, if you would, with regard to research, regard to conferences around us, expositions around us, any opportunities for higher level care professionals, doctors, nurse practitioners to come in and give back to the program. I think that's how this program will stay up to date and beyond with emergency medical services. I think a college degree is extremely advantageous to the provider and the institution itself. So with the college degree, I actually have my associate's in applied science in emergency in EMS. That's my first degree that I received. And with that degree, you are taking anatomy physiology 1, anatomy phys 2. You're taking microbiology. You're taking psychology. You're taking chemistry. And it's important to know as a healthcare provider that all body processes function at the cellular level. And these classes introduce that to the student. And furthermore, it enhances our knowledge base of anatomy and physiology. There's a lot of cellular components that take place within the human body that we could better understand and explain to our students or to other EMTs as paramedics about why things are happening at a much micro level versus the macro level without the degree. Compassion, and good moral character. I'd like to see some more self-defense skills. In the program I teach at, I have a former student come in and teach very, very basic deflection skills should one of the providers come into trouble, if you would, with the patient in a closed environment, i.e. the back of an ambulance, ways of deflecting diffusion situation. But there's a lot of times where patients attack healthcare providers, and that's not something that we talk about nor prep for often at all. It's helped me become a better communicator with humans. It's helped me be more passionate. It definitely has kept my humility in check as well. The clinical, I would say I had a young man who was involved in an ATV accident, and I made the decision to fly him via helicopter to the hospital based on his clinical presentation. And that decision did in fact save his life. He's without any neurological deficit because he did have a head injury. Um, so that was probably my biggest accomplishment, which is fairly recently, by the way, over a span of almost 31 years. And in the classroom setting, for the first time, I assigned my final exam to be a research paper, 3-page research paper with at least one reference in any topic related to healthcare. And I had my recent summer class had all 45 students complete 45 excellent research papers, which I read through, and I learned one thing, at least one thing from each paper. That was a very significant accomplishment for me. Compassion and knowledge. Compassion and knowledge. Because knowledge is everything.